Hello, Dr. Bateka, and today we'll be showing the regenerative injection technique and usage of PRP, which is platelet-rich plasma, in the patient in order to speed up the healing process and alleviate the pain. Gedimenas, my patient here, he was involved in a car accident, and as a result he injured his elbow and his knee. We did the MRI of the knee, and the results of it showed that the patient had MCL tear. This is the correct knee right here. This is the femur right here, and this is tibia, and this is the ligament that was ruptured. This ligament has three attachments. One is in the distal femur, which is here. One is in the meniscus, which is right here, and one is in the tibia. Therefore, they will be given 3 injections in this area. 1, 2, 3. We are using prolotherapy technique to use the PRP. In other words, there is a prolotherapy technique of injection into the knee, which are a little different than intra-articular injection or trigger point injection. The prolotherapy injections are in this area are given in the area of where the bone means the tendon, right in this area in the meniscus, and again in the bone. So the 3 layer will be injected, and after that we will put the plasma graft right in this area. Okay, so that's it. So the blood is being taken. Now the blood is drawn, and we have 60 milliliters, and we're using a large chamber here. This is a special device, that a chamber that designed by the Harvest people, that will be used for the platelet separation. It consists of 2 chambers and a sterile cup. The blood will be filled here, and after separation, platelets will be here. We'll show you. Right now, Irene, she was going to put that down, the anticoagulant in the little chamber where the platelets will be. That's anticoagulant, and she puts this so the platelets don't stick. Okay, and now she'll transfer the blood into the major chamber. And that has to be done not fast and slow, because if you do it fast, you can destruct the cells inside. Because remember, the blood consists of few elements. One of them is plasma, one of them are red cells, there are platelets or collagen cells, the one we'll be using today, and there's also lymphocytes and stem cells. If you do it very fast, or you do it very small diameter, the cells will be destroyed in the process. So therefore, she's doing very slowly and do it the right way. And unfortunately, a lot of people do PRP. And let me just tell you about PRP. PRP available for about 20 years. And the first was utilized at the heart surgery, where the surgeon didn't want to use blood transfusion. It was used very successfully and used for all the sprains, strains, minor tears, wound healing, ulcers, and so on. And it's pretty good technique used in the musculoskeletal regenerative medicine. And unfortunately, a lot of doctors, even orthopedic doctors, they use plain centrifuge, they use plain tubes, they use for the blood drawing, and the results of extrapolating the Buffy code is not the same. It has to be correct chamber, correct amount, and correct speed of the centrifuge, and correct chamber. So in order to have an optimal results. So now that Irene is done with the depositing all the blood in the chamber, she'll carefully pick this up and she'll put it in the machine. This is the Harvest machine, and this machine is designed for the correct platelet separation. This machine is also used for the bone marrow transplant. This identical technology using that such stuff, and voila. Now, in order to do the proper technique, we have to identify the anatomical borders and the proper injection spots in the patient. This is the area of the medial collateral ligament inserting into the meniscus. This area right here. Do you feel any pain right here? Yes. Yeah, this is the area of distal femur. This is distal femur here. Okay, and this is right here is tibia. So this is the 3 points where the medial collateral ligament attaches, and I will be infiltrating all these 3 spots with the anesthesia, local lidocaine and marcaine, in order to prepare this area for successful anatomy. And I'll be using ethyl chloride initially to numb the area right here. I'm just taking the blood out in the machine. Just carefully placing here, not to spill the chamber. Place it right here. I'll show you what's going on right here. If you look right here, that's where all the blood is. Okay, with plasma. And this on top is plasma, and this is PRP, and there's very little layer here. It's a white layer. It's called buffy coat. That's what PRP lives. That's where all the stem cells are, just in this area. So we're going to extrapolate this and transfer the syringe and inject. Here we have a micromedia syringe. Basically, it's a plastic holder that holds 2 syringes. One was the PRP inside, it's right here, and one was the thrombin right here to form the graft. And this will be injected simultaneously into the area, so it will form like a blood patch. And a little bit, move it around. Now we need to have a tape, a blue tape, put in the corner, and basically we'll fixate this area. It will be a little tender for a couple of days, and after that it will be fine.